Well, it's 2 o'clock. I wish you a warm welcome after lunch. It's always a difficult time, but we will have a very exciting, interesting session. My name is Luc de Witte. I work at the Hague University of Applied Sciences. And I'm very happy to chair this session because it is about making university, higher education accessible and inclusive. Let me see how this works. Do we have the slides? I have a slide deck. Yes, there we are. Well, that's about me. That's not that interesting. Why are we here? Why this session? I absolutely should not need to tell you. You all know, because that's why we're here. But I find it quite terrible that when I entered my new job at the university in The Hague, I hardly see any student with a disability. And that is because they just don't enter higher education. And only those few that do, we have some support, but even that support is very, very limited. And I think that's the situation in, basically everywhere. And that, in my opinion, has to change. Because it's the most fundamental source of inequity. And on the positive side, there are, of course, great examples of how it can be done. There are really exciting examples of universities and higher education institutions that demonstrate that it can be done. And that's what we want to talk about. So this session is presenting some of these examples. Part of those presenters today are among the awardees of this conference, but not all. But together we will give you an overview of what's possible. And I hope that will inspire everyone to go home and think, oh, what can we do? And that's the main aim of this session. Does this thing work? May I have the next slide, please? So what we'll get is not 6, but 7 examples of good practices from very different parts of the world. They will present themselves, so I'm not going into detail. And we will finish with a more personal story from one of the Zero Project. But what's it called? How do you call this group? Yeah, the youth voice, that's it. Yes, of course. The young voice is that sounds strange. It's a youth voice. And that will be the final presentation. So I would suggest that we get started. We have an order, and the first to present is right next to me. Abdullah Al-Motiri from the King Abdulaziz University in Saudi Arabia. So please, tell us your story. I'll give you the clicker for the presentation.
For access, make sure that the interpreter can see me fine. Just well. Good afternoon, everyone. Again, my name is Abdullah. Recruiter. University, known as KAU, and that is located in Saudi Arabia. Today, I will be presenting an example of the work that the university has been doing to support the deaf students. That's the university's education. Brief background about KAU. Largest public universities in Saudi Arabia. Ranked Mideast University. Is supporting people with disabilities, students with disabilities studying in different fields. That their studies are accessible and that their needs are satisfied. Out of that number, 30% of all students with disabilities at KAU. 30% is indeed a high number. In accessing education. School without a good education, which means there are barriers to them entering a university. Reason is their Arabic language abilities are not too developed, and their scores in standardized tests are very low. So, in understanding that problem, the team at KAU worked on figuring out a solution on how we could support this population. First year preparation program called First Year Preparation. This program is an intensive study language. Preparation is done before they are actually admitted into their course of study. What that program and curriculum looks like, that year of preparation. What we do is we work first to identify the students' needs so that we can meet them where they're at. And then we have 4 levels of literacy development where we help them improve their literacy before they enter the university. It's tailored to the students' individual needs. We use visual supports amongst many other techniques. We use sign language as well. We have a sign language library that shows sign translations of a lot of academic terms. And so we've developed a sign language library that those students are able to access, and they quite often rely on that library for review to signs. We also provide mentorship and guidance. I am one of the mentors. I am a deaf mentor that works with the students. I do have a high level degree. So when they communicate with me, they have communication in their native language, which means they receive a direct understanding of what's being said. With the beginning of the program to current time, many students have benefited by being able to enter a study in a major that they prefer. Study majors is digital media and fashion design. Majors are currently open for them, and we continue to add more majors in more areas of study. The number of students we have is also growing. In 2018, we only had 18 students. Currently, that number stands at 100 deaf students, and we continue to prepare to be able to allow more deaf students to enter the studies. As we've worked on this project, the government department has recognized the work we do and has given an award for our proposals and the work we are doing. Has had positive impacts on the lives of students. This is not just about improving their communication skills. This is about improving their communication skills with sign language, which really allows them to develop their self-esteem. And with a robust self-esteem, they are able to better navigate the university life experience, meaning they are able to build confidence, self-esteem, and engage in different areas of academic life. All this by boosting their sign language and literacy skills. has experienced challenges along the way. We have identified challenges within the community and outside of the community. One is to develop an awareness about deaf education and sign language. Currently, that is not as robust and as strong as we would like it to be. What we do is we disseminate and share workshops on sign language as well as education. Through the workshops, we spread an awareness within the community that sign language exists. Another huge challenge that we face quite often is a lack of qualified sign language interpreters. They are difficult to find. In Saudi Arabia, there really are not interpreters available for academic work. So we've tried to find those interpreters that can do the work and have the skills to be able to work at the university so that they may serve as interpreters for the students. Future, and some of the plans we have are to continue to expand the services. We want to increase the number of studies and majors offered to the students. Also provide support to the students. We want to start a program for interpreters to become certified in their sign language skills. We believe that we have valuable experience that we can share with other universities that they can then replicate this experience for deaf students in their areas. The panel and the host for having me here. I would also like to thank Dr. Wazan, my colleague who I've worked with for years and has provided support to the program since its beginning. I am very grateful. Thank you.
Yeah, thank you very much. I think that's a very successful example of what can be done. So thanks for that. Let's immediately go to the next speaker, who's next to me. Agnes Sarolta Fazekas, is that correct? That's okay, from Hungary. Well, go ahead.
Thank you so much. The slide, please. Yes, thank you. My name is Agnes, and I'm honored to be here. I'm representing the CHARM EU European University Alliance. And please, the next slide. Or I can do the next slide. Let's see if it works. Yes, it works, and I also will be very attentive of time as an access need as well for everyone. I would like to address 2 points here, that the higher education environment globally has been changed very tremendously, both in numbers and both in the nature of higher education landscape, and we need to respond to the changes, how we design, implement, and monitor higher education sector, and also this is a global issue for us. And I also use the relevant resources that are also mentioning these. So that bringing this issue as a global case, I'm delighted to be here with many wonderful colleagues and people around the world who are working in the field of higher education. And when we were having the time for discussing this panel, we discussed that what brings us together, and I found, I come up with the word interlinkage, that we are joined together and our projects are not in, separate from each other, but are together. And I also was very delighted from the early morning, from the opening until the afternoon, to hear from other topics that the connecting points. So I can already relate. And I think that the design, how we design spaces, are the common ground. So I brought this as a conversation starter, this interlinkage. And when I was researching for this presentation, I found an amazing tool online, which is the UN Sustainable Development Goals interlinkage web tool. And I just found it very fascinating, so I really recommend for you to take a look how the different SDG goals are interlinked interconnected, and also when we are talking about SDG number 4, how we are connecting with other goals as well. So it's again interlinkage. So about the Charm EU, what are our best practices would like to share with you is that how we implemented from the beginning our work and how we said that it will be a core value, and I also outlined for your access the core values. And what I would like to say is that we work under the holistic, intersectional and human rights-based approach to inclusion. Individuals with disabilities are part of this diverse group, and of course we try to be as responsive to the needs of individuals from gender to refugee status to all kinds of socio-economic issues. So again, humans as having intersectional identities and facing barriers and also privileges. So I listed some of the key examples that we did. One of the first element is co-creation. It's a very nice word. Usually we like to use it as a buzzword, but how it really goes into the day-to-day life in our Charm EU community and around the partner universities is that we create a space for dialogue, and it's sometimes very difficult, I must admit, to bring different professionals and individuals and also individuals with lived experiences together, but we really decided that we will try this democratic process from the onset, and we also support our students and staff. We created so many resources that can be replicable or can be adjusted to your own organizational goals and needs. And also, just one thing back, maybe, if I can go back with the slide. Yes, that we also try to address that even if it's a master program, that part of the Charm EU, we run a global master program, we try to make sure that it includes aspects that are reducing financial barriers. So that's why I really wanted to highlight. The next thing is that of course, we design the curriculum and also the whole accreditation process of the master program from the beginning was very much in the mindset of inclusive design. But of course, we understand that certain students need certain specific attention or specific meeting their needs, so we are also doing the needs assessment, and as well we are supporting our professionals and academics through different professional development sessions and tools and quick wins and easy solutions to make sure that it's a step-by-step process. And we are also joining the UN International Days and following press releases regarding that, what is current to our objectives and topics, including the SDGs. And what I would like to highlight is the testimonial of our student. I cannot read from here, but I really recommend for you to read it later or have access later. I think those students who are with us in these programs and also the colleagues are also co-creating with us this whole experience. And I would like to just address that, again, it's a step-by-step process. Although we are very ambitious, we are also seeing that there are financial and human resource difficulties, but we always try to make the steps. And what is also important, that we are very glad that we have wonderful partners from the public sector, from the private sector, and also from the civil society sector, meaning that there is a constant dialogue and discussion how to improve the work, and we are also working a lot with our students. And from the beginning there has been, even for the whole Charm EU structure, but also for the master program, this co-creation is happening through different dialogues. And of course, reflections and a lot of constructive comments that what we can improve. I also note that there is, and the time is up, oh, I should close it, yes. No, how to do that, okay. And just to highlight it that it's a step-by-step process, but I think this award also keeps us for a moment to celebrate, but further on keep the work for a world for zero barriers. Thank you so much.
Excellent, thanks a lot. Yeah, we just keep going because you have lots of examples and then you have room for discussion. I think we go to Amanda immediately. Well, I think you introduce yourself and wonderful, thanks.
Okay. Hello, everyone. My name is Amanda Krause. I'm from the University of Arizona in the southwestern United States, and I'm delighted to be with you this afternoon to share with you how we use universal design to expand our concept of disability access on campus. At the Disability Resource Center, all disability access is centralized through our office, so all compliance with the Americans with Disabilities Act for students, employees, and guests. And the university enrolls just about 50,000 students and employs over 10,000 staff and faculty. We're also a big part of the Arizona community in that we have sporting events and museums, concerts, theaters, all sorts of things. So all of that access is centralized through our office. And we work not just on individual accommodations, but through proactive campus outreach to ensure that the physical, digital, communication, and workplace environments are accessible. All with the goal of disabled people, students and employees, having a very similar, if not identical, experience on campus with respect to accessibility as their non-disabled peers do. There's a photo of the front of our building, but I like to think that our model is internationally recognized. We often host guests from the US and around the world, and I would say that a strength of our program is that centralization. Also the size and scope of our department. We employ over 40 professional staff and work with 100 plus campus colleagues who perform various accessibility related services. And our campus partnerships are really what will transform our university community into prioritizing disability access, and I'll talk about that in a moment. We're also very proud of our adaptive and wheelchair sports program. We currently have over 60 students rostered on our teams. There are 7 teams, 3 individual sports. We have an adaptive fitness center, and over 50 Paralympians have come through our program. Skip that. In terms of trends, what we're seeing right now is an increased number of requests, and this is not unique to the University of Arizona, but shared across the country. Not only are we seeing more requests, but we're seeing requests come in later and later into the academic year. These requests are more complex, often new diagnoses, perhaps related to the COVID-19 pandemic, with unpredictable symptoms. So students, relatedly, are feeling unprepared to be at university. There are challenges in accessing their classes and managing their time and stress and adjusting to an in-person curricular environment. So what we're seeing across these requests are, an interest in flexibility, both from employees and from students in terms of their work schedule, deadlines, attendance. And that really leads us to think about how we can implement universal design to meet the needs for flexibility. What informs our work at the university, I'll go through this quickly, but you have the slides available. Disability studies, which considers disability naturally occurring on the spectrum of human difference, so something that we should anticipate. Of course, legal compliance is a big part of our foundational culture. Social justice, and universal design. We operationalize an expanded concept of access. So rather than just looking to narrowly interpret the law, we try to be as forward-thinking as we can, putting the most inclusive and equitable solutions in place. There's a very simple spectrum on the screen representing access. On one side of the spectrum is compliance, which is often individual and separate. The other end of the spectrum represents inclusion, which is shared and, in best case, identical, right? It is also compliant. So we try to encourage our colleagues at the university and around the country to begin with a concept of access that is actually equitable and inclusive. It will meet our compliance obligations and create a more inclusive and usable experience for disabled people. Universal design, one definition, the design that is usable by all people to the greatest extent possible without the need for adaptation or specialized design. That's what informs all of our interactions and our outreach. And there are two images of our university commencement there, which I'm using because it is as fully inclusive and as fully universally designed as a ceremony can be, with ramps going up to the stage, with ASL interpreters on the stage, captioning on the stage, and seating all around. I'll end with how important it is to think about access systemically rather than only individually. If university campuses only respond to disability access individually or barriers individually, that is all we will ever do. We need to address barriers systemically, and that means working with our campus colleagues to think bigger and think differently about not just disability access, but about the value of the disability experience and the disability community. At Arizona, we are very lucky to have wonderful colleagues in the physical environment where we are reviewing plans for construction and major renovation projects, for events. In the digital community, where we are reviewing purchases for major pieces of software to ensure that they're accessible, where we are testing products and software and applications to ensure that they're usable to all of our users. Similarly, we have relationships with faculty and how they create a universally designed curriculum. And we represent disability on a number of committees, to again, represent the disability experience and disability perspective across all areas of campus. This is ultimately what we believe will change minds about disability and change campus culture so that our campuses are more readily accessible and inclusive for disabled people without them needing to make requests. Thank you.
Wow, I think that sounds really impressive. And as far as I know, this is probably the biggest program I've ever seen in the university context. Maybe I'm wrong, but anyone heard anything bigger, more advanced than this? I don't think so. So
they're the best in the US.
Yeah, the best in the US. Yeah, that sounds like. Well, but you have a chance now to compete with her. I think you, yes, yes, you are the next one.
I cannot compete with Amanda. Yes.
Okay, well, we'll hear from you then. Yeah, I'll give you this.
I did. This one?
Yeah, there you go. Yeah.
Oh, the microphone button. Yes. Oh, we need a microphone. All right. Hello, everyone. I am going to use American Sign Language so I can provide communication access to my colleague. So I just want to shout out to my colleague, Ji Yuan, who came here from China. He's one of the graduates from our program that I'm going to talk about. Ji Yuan, you want to stand up and just say hi to everyone? Yes. He's very excited to be here, and he's happy to talk to you about his story. After this presentation, he'll be at our booth. But anyway, I'm Amy Hebert-Knopf, and I am the Director for Education and Research at St. Cloud State University. I work for the Center for International Disability Advocacy and Diplomacy. And I'm excited to talk to you about an innovative project that we developed along with our deaf colleagues. Do I press this to go next? Okay. So we're so excited that this year we're able to unveil a deaf graduate certificate called Deaf Leadership and Advocacy. And it's a one-year program, and it's very innovative because we've been able to waive English language requirement and have sign language as a requirement for the program. And I think that's the most important part because a lot of deaf students are not able to get into programs because of that English requirement at our institutions across the U.S. So this is a one-year program, and it's very interactive with our partners from deaf schools across the U.S. So they spend one semester at St. Cloud State University, and then their second semester we actually place them in a K through 12 school for the deaf, where they teach their home language to American deaf kids and culture. And so the deaf students in the schools are learning a second foreign sign language, and our students are learning some very valuable leadership skills. They also have a research project that they're working on from the first day they step foot on campus. And that research project is whatever their interest is, whatever they want to develop. And you were talking about wanting to develop a sign language program at your institution. That's something that you could do as part of your project. And then their last semester is either done with us or back in your home country, where they set up a summer camp or workshop so that they can then provide their leadership skills, demonstrate them, and teach other deaf individuals from their country. So it's really exciting. We're very happy that we're able to accept 30 students this year, and we hope to partner with many of you to scale up and grow the program. All right, just very briefly, a timeline. This project started with one student from China who came to Minnesota and taught at one of the charter schools that Dr. Cardano was talking about this morning in her keynote. And then it grew to a pilot that included Ji-Wen, who is here today, plus 2 other interns. And now we've learned so much about the project that we were able to grow it into an actual program, a graduate certificate program. And so we're excited to be sharing this with you today. And we're excited to be a 2024 Zero Project awardee as well. I think the most important aspect is the people-to-people exchange and how the students who are coming to the program are able to learn from other deaf leaders. So the curriculum was developed by a deaf educator. All of the courses are taught by deaf leaders within the community, and students will have the opportunity to go out and travel and meet other deaf leaders in the community as well. Just having the opportunity to develop their own research and learn what that is included in developing research and publication, and developing those important global competencies. So not only for our students at SCSU, but also for the K through 12 students that are in the deaf schools, because now they are getting to be exposed to deaf leaders from other countries as well. Also, inclusive diplomacy, again, the exchange, the practicing of different cultures. You'll see in the next few slides that we have some pictures of what some of our students did when they were with us, and how much that makes an impact on the students and then the students in the K through 12. And then also the advancement of human rights. Communication access is still a major issue, even within the US, even here today, communication access is an issue. So being able to provide more innovative projects to be able to have communication access is really important. On the slide, I have a few pictures from some of the K through 12 schools. The first picture shows one of, we had a supervisor of the interns, and she has all the students in the K through 12 dressed up in Chinese traditional wear. And then there's also other pictures of instruction. There's one of GUN who stood up before, getting a lesson plan together. And then in the very last picture, they're teaching Chinese dance to some students at Metro School for the Deaf in Minnesota. So the impact is really huge, the opportunities for increasing communication access, but then the opportunities for employment once our students graduate and go back home, the increase of the social cultural value of deaf identity and deaf community. One of our students said that the first week that they were in the US and just being exposed to so many deaf people and deaf cultures that he learned, he didn't know anything about deaf identity up until that point. So deaf identity became realized, understood for him. So, and then the expansion of academic disciplines. We started with China because in China you're very limited into what you can major. Currently it's art, graphic design, and music. And so for deaf people in China, they really want to expand their majors that they can go into for employment. Our next step really is about just maximizing our research, and again, adding the training component and scaling up. And so we really would love to partner with other universities in how we can scale up this program. In China alone, there are over 20 million deaf people. And so we know across the world, we need partners so that we can really scale up the program for deaf people all over. And that's our email address if you'd like to contact us for more information. And please come and see us at our booth, and Juan will be there so that he can share his stories with you.
Oh, excellent. Thank you. This is really exciting, these very different examples. And it gets even more exciting because we're going now to hear about a program in Uganda. It's, oh, I need to walk, I promised you. Oh. Get some exercise. Here it is.
Thank you. The PowerPoint, how do I? Okay. Thank you, everyone. Good afternoon. My name is Erica Bojarczyk. I'm the Content Development and Documentation Specialist at Light for the World based in Uganda. And I'm, ooh, we have the wrong PowerPoint.
You said it was one and the same.
We sent it to, it is. It's okay. We'll manage. So we're here today with Ines Ongus, who is from who is our partner university from United States International University of Africa in Kenya. Can we get the next slide? Okay. So today we're going to be talking about the Capable Platform, which is an online resource platform designed to support African universities to put disability inclusion into action on their campuses. And then you'll hear a little bit more about those best practices in action from Ines himself. So the Capable Platform was launched in 2021 by Light for the World to provide disability inclusion technical support to the MasterCard Foundation Scholars Program in several African countries. And it serves as I said, as an online research platform. and houses a unique range of disability inclusion tools and resources, such as an e-course on the basics of disability inclusion in higher ed, and best practices about disability inclusion across the continent, as well as a board game that we developed to help people better understand the journey of a university student from admissions through graduation. And to date, as of this morning actually, we've reached about 40,000 users globally. We hit that number this morning. And we're starting to really see impact beyond our initially intended audience. Okay. So some of our key enablers to success have really been the strategy that we've put in place to provide technical support to these African universities. That kind of has a three-pronged approach. So first, about 70 master trainers across 10 different universities have been trained to drive inclusion using Capable as a resource, and they regularly use the platform, so that contributes to its growth. We also have a growing community of practice made up of disability inclusion focal people, which share best practices and again gives us content for the platform so that more people can learn from it. And we also have an inclusion working group that meets quarterly and discusses themes related to content on Capable. And it brings in a wider audience of universities, including large universities outside of the African context. And USIU is an active member of all of these groups. And we've seen a really high level of partner engagement overall, which has allowed us to continually build and tailor the program and the content on the content on the platform to make sure it really suits the needs of those African universities first. Next steps for Capable are pretty exciting. We're really scaling up this concept and this platform to include a wider range of disability inclusion resources under the new We Can Work program in partnership with MasterCard Foundation. And you can look forward to more interaction with other people on the space, including hearing more directly from young women and men with disabilities. And we hope you'll be a part of this growing community. And as we grow, we really want to make it as engaging as possible, so we want to continue gamifying the learning experience. Yeah, and we will continue providing resources for higher education as well. So I'm going to pass things over to Enos so he can finish the time and talk about what USIU has done with some of this information, and hopefully the PowerPoint can get worked out.
Can I have the PowerPoint up? Yeah, by way of introduction, my name is Ines Songus. I serve as the Director, Advancement and Partnership at USIU Africa. I am 5 feet tall with 11 inches. You know, I'm an African. I wanted to take you through, the key successes, having Erica presented, about our partnerships. So we pride ourselves that the key success to inclusion is the kind of collaborations that you build. And our collaboration with MasterCard Foundation, Light for the World, and USIU Africa, has enabled us, at this stage to be able to scale. Prior to July of 2020, we were only having 5 students with disability. Fast forward, 3 years down the line, because of the kind of collaborations, we are boasting of having 72 students with disability, and we are admitting all forms of disability, whether physical, visual, hearing, and invisible. So as a result of the kind of capacity that we've been able to, build over time. Some of the featured initiatives that enable us to achieve this success, we boast ourselves of having a curriculum for sign language. As my colleague said, indicated that having sign language interpreters is a challenge, especially in higher learning institutions, and if you have students with disability taking multiple programs, because all our 38 programs are available for all students with disabilities. So that would mean that you have multiple interpreters that are program specific. So what we're basically doing, we are building capacity for the entire university on sign language interpretation. So we've got a curriculum that we've developed that is available to staff, to faculty, and to students on sign language interpretation. We also have a club, as an institution, a sign language club, which admits all our students. We have students from more than 50 plus nationalities across the world, and 47 counties in Kenya. We run a county system, so they are eligible to participate in those clubs' activities, and those clubs basically features, awareness, about issues around disability and inclusion, on the entire campus. Again, in terms of promoting access, we have Disability Inclusion Resource Center. This Disability Inclusion Resource Center is actually with the support, of partnership with the MasterCard Foundation, that has supported the equipping, of this particular facility. And then we've also worked very closely with Light for the World, on the skilling component of it, so that now we'll be able to provide, the guidance, on issues around, accessibility, and using the capable platform, to provide resourcing and tools, that enables us to, basically scale. The Disability Inclusion Center help us, and help the university, in relations to providing guidance and training on assistive technology, which is critical, and adaptive equipment to persons with disability. Does regular maintenance of this assistive technology and support curriculum, and content development, and other material adaptation, for accessibility. They also assist us within the center in terms of implementation of individualized, reasonable accommodation plans, for our students with disability. Some of the key enablers, for promoting accessibility at USIU Africa and at universities generally. Number one, collaborations. We need to constantly be out there seeking for collaborations, because collaborations work. And these collaborations are collaborations with the senior institutions' leadership. The reason why this is important when it comes to budget allocation, they come, when it comes to approval of progressive policies, then they come in handy. So collaborations is critical, not just externally, but internally as well. The second thing is around systems, and I'm glad participating in this conference, you are able to meet different vendors of different technologies that will be very helpful in terms of the systems, tools, resources that will go a long way. The third area is around policies, progressive policies, and procedures, which guides the operations, on any disability and inclusion activities. And then finally, it's important to invest in capacity building. Let's invest in capacity, of different stakeholders, so that now we are able, to take on this and put in sufficient, budget. So I want to thank you, and looking forward to engaging with fellow colleagues, on what else we can do in terms of scaling. But in terms of the next steps, because we've learned from the infrastructure that we put in place, we believe that we are able to scale, and we've revised our disability inclusion target from 7%, to 10%. So we are looking forward, to scale, based on the learnings that we've learned. We might not be Arizona University, but we are looking forward to be the Arizona University of Africa, and then we, again, asking to continue seeking partnerships for inclusion and investment in technology if we are to succeed. So I thank you, and looking forward to interacting more.
Well, you set yourself a good goal. I feel the competition, wonderful. And we have one more speaker to go, for whom it's kind of a home game, Linz. I heard earlier today it's 180 kilometers away. But please, Johannes Fellinger, tell us about the program in Linz.
Good afternoon. Whereas my pre-speakers majorly addressed access to higher education for those who have special needs, my focus for this session will be how to prepare future medical doctors to serve people with special needs. Of course, the vision is that future medical doctors are doctors who have special needs and those who have no special needs, regardless, that they could become physicians with whatever preconditions they have. But the main focus now is to strengthen the vision of fully inclusive medical care. How can this be achieved? The first thing is, of course, to serve on grassroots levels wherever you can. But finally, you have to train the people who will be the key persons in healthcare. And my experience is better train students than train doctors. Because doctors who have finished the studies are busy and they know everything. But students have a vision before money spoils them. They have a vision to become a serving doctor and to want to make a change. And so I thought it is a good opportunity to embed within the medical curriculum the whole concept of inclusivity and special needs throughout the curriculum. So, but first I want to paint the picture about what is inclusive medicine. Of course, the whole conference, zero barriers, that's what we are actually driven by. This is coming to the brains of many people. The doors should be wide enough, no scales you can't overcome. When it comes to communication, there's already a big gap. Here with this first picture, I show the person with a wheelchair only needs to get the door wide and the person can access the building without a problem. But what does the second picture show? The first is barrier-free, but the second shows specialization. If we want to have inclusive medicine, we have to be willing to be specialized, to really meet the person's needs in a very competent way. This cannot be achieved by reading a book only about that condition, but also by meeting the person. And so the two persons are looking on eye height, and the other one is bending towards the other person, which also shows specialization has to do something with teamwork. If you have special needs, sometimes one discipline is not enough. You need different disciplines working together, which is also not the most common thing in medical education. But the third point is even more challenging. Usually doctors think they know a lot, which is not true. We think, but we don't know so much. But the main thing is that if we want to become really good physicians serving people with special needs, we have to be deep learners. So this kind of inclusive medicine is also addressing the need to be a learning physician trained by a person who is an expert for him or herself, or from the parents of children who have special needs, and to embed these experts in the whole medical field as experts, not as people who are allowed to give the commands. No, we need them as specialists, like a cardiologist. They get specialization also if they have a full training, but they know a lot. Most colleagues don't know. So maybe to employ peers in the medical staff. And the most important point is, I think, which I always try to train my students, to have always in mind AIM. I called one of our clinics serving people with special needs Ambulance for Inclusive Medicine, with acronym for AIM, but I use the term AIM much more for getting an attitude which is driven by the question, what do you want? What is your need? A question you have to ask, not only superficially, but ask in a way which shows that you are completely willing to listen and to learn. So I think this is the key element of what I try to train and what we could embed in the Faculty of Medicine at the Johannes Kepler University in Linz. It was more easy to start a new faculty for medicine than to change a program which is well established over years. So we took the advantage of having the enrollment in this new faculty, and so we implemented the topic of inclusion, developmental disabilities, human rights in the whole curriculum. Not just as an elective for some few interested students, but all students should be hearing and listening to that topic. So far, since 2014, quite a few students have passed that curriculum, and of course, sign language courses also are offered, and they are highly requested by the students. So we are embedded in ethics, in pediatrics, in neurology, in psychiatry, in otolaryngology, and for those who are more interested, we have an elective in developmental medicine with a lot of practical interactions with people with special needs. What do we teach? First of all, to have a holistic view of disability, not only a medical view, but also a social view.
Can you summarize that a bit?
Yes. The second point is to have a view on the human rights, on the UN Charter, and to enroll also, and to have a vision of the parents and relatives' roles, and to give doctors skills to interact with people with special needs without being anxious or incompetent, and to work in teams with other disciplines. This is the most important in short, and that is one piece of art. My dear father has created a sun which shows everything is a gift, but we have to open the grass, let the sun shine down. Thank you.
Yeah, thank you very much. From a personal note, I think it's extremely important. When I was trained as a medical doctor, I had heard nothing about these issues. And when I, by accident, ended up working in a rehabilitation center, I thought, my God, this is a totally new world for me. So it's great. It should be part of any medical curriculum. These were the examples, but now we have one more presentation to go, a short one again, by Yardena Gowin, who will represent her own story, but also something from the Youth Voices from the Zero Project. So, please.
Hi, everyone. It's so great to be here. My name is Yardena Gerwin. I am a white Jewish American woman with curly hair and a black and white checkered suit. So I'm currently receiving a degree, a master's in health and medicine at Cambridge University. And last month, I was not in this great big room. I was in a very small archive learning about the history of disability at Cambridge. And what I was learning about the history of disability at Cambridge is that they do not currently have one. There is not currently an archive of disability at Cambridge, and there has never been an exhibit on the history of disability at Cambridge. And then when I was speaking to the amazing archivist that my college does have about how do we trace back the history of disability at Cambridge, she recommended that I look at photographs of students with disabilities. And the way that I would trace back these students with disabilities was to look at class photographs and see the X's, the crossed out images. And she said that every photograph, every class photo, one of the ways that they would mark a student with a disability, a student who was ill, or a student who disappeared in these photographs was a way to trace back the representation of disability. And standing in that archive, it really made me think about my own personal story. And it really made me think about being a high school student when I had to leave my religious day school because they let me know that they would not be able to provide accommodations for me when I became ill. And when I first got to college, and despite having lots of medical documentation and being told that that documentation was not sufficient and that they would not be able to provide me for accommodations, and the X that would show up on my face in that situation. And thinking about when I transferred to a really amazing university, I asked for a medical waiver because I had never taken standardized tests. And when I first transferred, my application was actually placed in the junk pile because they were not test optional. They had required, this was before the pandemic, and they required standardized testing. And so I was placed in the junk pile, and I imagined another X on my face. And this experience is not unique to me. It's an experience shared by so many students in the United States where I come from, and so many students in Europe and around the world, as we have heard from, in Africa and internationally. And thinking about all of these X's historically and in the present, one of the things that I realized when I transferred to my university, Middlebury, and became the first student to design a major in disability studies and social determinants of health, was that one of the most challenging things that a student with a disability has to bear is that their experience is unique, is that the bureaucracy that they have to navigate is something that is unique to them, when actually it is institutionalized. The students who had these X's, the students who were disappeared, they all have a story to tell, but it's the university that marks the X's. It's the universities that create these bureaucracies. We are always telling students that they need to advocate for themselves. Any student with a disability in higher education is doing an excellent job advocating for themselves, what they need. And what is incredible here is that we are seeing that higher education needs to help and partner and advocate with these students. We need the systems, we need the supports to partner with these students. They need to be advocating. Policymakers need to be advocating. Corporations need to be advocating. And when I researched the experiences of students with disabilities, I saw that they were advocating all the time, but they actually needed to learn how to advocate. We're higher education, we are institutes, we can teach students how to advocate, we can build the systems of support. Because questions of disclosure, questions of what do I do in the workplace, this is not rocket science, but it's also not something you learn how to do rocket science. We need to learn how to do this. And students were scared, students were really scared. And I became a student who learned from so many of my peers. I became the first student to actually teach my career center. They hired me after I did my research. They hired me to teach the Career Center on disability disclosure because we were not actually trained on disability disclosure. So as a student, I was teaching my career advisors how to talk about disability disclosure. And it turns out that when we actually speak to our students on how to disclose that you have a disability, it makes it a lot less scary to disclose that you have a disability in the workplace. But this whole process in higher education, if part of the process of going into higher education is to actually get a job, we need to learn and we need to teach and we need to prepare students how to do that. And as I now work as in my master's on this in the UK, and Europe is doing a lot better of a job in preparing students with disabilities in the workplace, I think what is so important is to say that we need to partner with students with disabilities on this advocacy process, and we actually need to prepare them for the workplace in order to actually champion them and in order to actually have this wisdom. And students, as someone who also studies history, I just also really want to show everyone that students with disabilities have always been in higher education. It's not just a recent system that was created. Students with disabilities were always there. They were always learning differently, and in that way, they have always been someone and something that we can all learn from. And we need to return them to the picture, but we also need to learn from them, and we need to champion them. I'm so grateful to be learning from all of you. It is such an incredible opportunity, and thank you for all that you do.
Well, that's a very clear message, and I perfectly understand why they hired you. We have about 10 minutes left, 9 minutes, more or less. 8 minutes, oh my God, your watch goes fast. But we would have some discussion, but now it's only 8 minutes. I will limit it to one question, and to all of you actually. You have listened to each other's stories. And I would like to hear, in one sentence from all of you, is there anything that you heard from someone else that you want to include in your own work? Is there something that you take home and say, wow, that I will do? I started that side, and so you can think, one sentence.
Yeah. I think the certificate in deaf curriculum is a big takeaway, and not just picking that as a curriculum, but we'll also be organizing a visit on how it's actually being done so that it helps us scale in that area. Thank you.
Perfect. That's a very clear thing.
Yeah, I loved what you had to say about the systems and bureaucracy. So we want to have more youth voices, and we want to dismantle those systems so that we could be more inclusive.
Yeah, super.
He said he would like to partner with everyone on the panel to help the future be better for all people with disabilities.
That's a very wide but positive message. Thanks a lot.
Thank you.
Go on. Yeah.
Yeah, I think it's all about governance, university governance, and daily operations. So I was very touched by your thoughts on this shifting of advocacy. So I think that would be need. We would need this inclusive governance approach.
I also appreciated your comments about the systems being inaccessible, and it's a reminder that the institutions are responsible for access, not every individual student. So working with students and taking some of the burden.
I'm just so inspired to hear about a medical school and that is doing what you do, and it is a beautiful vision for a world of the future.
My takeaway is a little bit more personal than professional, but I really took away a lot from your presentation. Your story echoed a lot of experiences that I've had myself, and hearing them for the first time in this kind of public platform said by somebody other than me, was very impactful, and I think it will support my work moving forward.
Well, thank you. And the last one.
Very strong emphasis on support by peers. The deaf curriculum is also, I think, addressing deaf students being prepared together, not isolated. Right. And actually, there's a red line to you, because you are a strong peer. Encouraging another one, go ahead. And I think to take this with, for a user group or even for a simple one-to-one sharing, supporting, to overcome the barriers in higher education.
Well, thank you. My takeaway would be, I would like to take you all back to my university, present you to the board, and make them do something. There's a few minutes left. Is there anyone in the room with a kind of take-home message? Is there anyone that has this urgent thing, I want to share this, or want to?
If I may, could I ask Amanda, could you talk about the Gooden Network and our meeting on Friday for just a wee bit for universities to take part?
Yes, thank you, Kathy. Kathy and I will be talking on Friday with anyone who's interested in kind of re-upping a global university disability inclusion network for institutions of higher education who would like to partner and collaborate, share resources on how to advance accessibility on their own campuses, and learn best practices, share information for supports, funding, et cetera. So we'd welcome you to join us at noon? At noon on Friday.
Thanks for that. Anyone else? This is your chance, your 1 minute of fame. It's left. In the back. Yeah.
thank you for this very interesting presentations and conversations and discussion. My name is Alia Zergat. I'm from the Ohio Council for the Rights of Persons with Disabilities in Amman, Jordan. As an international student myself from Jordan going to the UK, I'm often faced, having gone through the process twice, that our choices to enter universities are often governed by how accessible they are and what this system has on the websites. However, in reality, and I thank you for saying that the systems need to be accessible, however, in reality, we find that the systems are not as accessible as they say they are. So I wonder, in your programs, if there is something that can encourage international students coming to your wonderful universities for exchanges, talking about budgeting for students who come in with the added burden of not only having to navigate a non-accessible university, or even a culture that is different to their own, or even finding their own community and niche, but also a system that also ensures that the person with the disability, the student with the disability, does not have to bear the added cost of entering the university of their choice. So what is there in terms of inclusive budgeting in your systems? Not only structural changes, not only attitudinal barriers, not only breaking down the cultural barriers, but also inclusive budgeting as a whole would be really helpful. I myself had at university multiple disabilities. I needed note-taking, I needed a scooter, I needed an adaptable room. So what is there in terms of university systems for inclusive budgets that can make students kind of a bit more relieved and to be able to navigate without the added cost of having to bear the brunt of paying more than the rest of the community of the student body? Thank you.
Well, thank you. We will not be able to answer your questions, and because time is up. I look at you. Now, but maybe this is a really big topic. Maybe it's better if there is a 1-to-1 or 2 or 3-to-1 discussion afterwards. Yeah, and anyone with a short answer?
I think it's a very good idea to address the budgeting point.
Yeah, it is.
And to reward a university for any student they take with special needs, not by emptying their budget, but giving additional budget by the government. A wonderful point to make.
Just also want to respond and thank you. That is something also to think about. But just also wanted to mention at our Disability Resource Center, it's in form of a library. So if you come in and you need a motorized wheelchair, you need additional support, you'll get them there, just to support, even if they're going for maintenance. If yours is going for maintenance, what do we then use? So we try to make some of these resources available at the Disability Inclusion Center. But again, if we have scholarship programs, we do have scholarship programs for students. We do budgeting that are encompassing everything that we call reasonable accommodation to make the student, succeed. But that is an important point in terms of what happened to students who are not sponsored. Can we go further to not just consider sponsored students and see non-sponsored students on what else can we do as part of inclusive budgeting? So thank you for that comment.
Okay, well, I think now we reached the end. Thanks a lot for your inputs. I think it was a wonderful show of very good examples, inspiring. I hope it inspired you in the room. And I suggest we will meet again next year, because this event takes place every year, and have a discussion, and maybe we can then hear from you all about progress that you made, and especially about what you have learned from each other and how we together grew. Thanks a lot, and up to the next meeting.